name is Jessica Dixon. I'm a nursing student here at South Alabama, and today I will be doing the NG tube checkoff. So the first thing I'm going to be doing is verifying the order in the hospital policy. So after I do that, I will perform hand hygiene. And then I'm going to identify the patient using two identifiers. So we have Jaguar J. Jones, age 25, 1963, age 25, 1963, allergic to penicillin, and penicillin is on here as well. So now I would explain the procedure to the patient and provide privacy. So now I would gather my equipment. I have my equipment gathered here today, except for my stethoscope and my pen light. So now I'm going to don my goggles. The next thing I'm going to do is I'm going to perform hand hygiene. I'm going to raise the bed to a working height, lower the side rail. I'm going to assess the patient's vital signs, oxygen saturation, and bowel sounds. If the patient had any change in vital signs or a decrease in oxygen saturation, we will need to stop the procedure until they return to normal levels. So the next thing I'm going to do is I'm going to raise the head of the bed to a high Fowler's position. I'm going to establish a cueing sound with my patient. So if the procedure needed to stop, just raise your right hand and I will stop the procedure. So the next thing that I'm going to do is I'm going to open my NG tube packaging. I would place some lubricant in the inside of the packaging, and then I would prepare my tape. I have my tape prepared here today, 4 pieces. One for measuring the NG tube, one for securing it temporarily, another for final fixation, and another for labeling. So the next thing that I would do is I would loosen my syringe on my, I would loosen the plunge on my 60 milliliter syringe, but I don't have that today. So now I'm going to apply my clean gloves, and I'm going to assess the patient's patency in each nair. So if you could cover one nostril for me and sniff, and do the other. Okay, so now I would clean the bridge of the nose with soap and water or with an alcohol swab before doing this. So now what I want to do is I want to measure. So in a typical hospital setting, you would have the shirt off, but I'm not going to do that today. So what you want to do is you want to measure from the nose, and then turn your head that way. From the nose around the earlobe, and then all the way down to the xiphoid process. So once that is done, I will mark my place right here. I will get my dog-eared tape, and I will mark that spot right there. So now I'm going to place it in a basin, and then I'm going to place a towel over my patient's chest, and then I'm going to, the patient will be laying down, so I'd place the basin on the patient's abdomen. So now I'm going to move on to my boxed patient. So now what I would want to do is I would want to cool this around my hand and then release. And then what I would want to do is I would want to lubricate the first 4 inches of this in my lube. And then I would want the patient to lean their head back, extend their head back to the pillow. And then I would insert this slowly and gently. I would make sure that the curved end is pointing down while doing this. So I'm going to insert. Once I get past the nasopharynx, I'm going to have the patient pull their head forward and relax, and then I'm going to give them some water so that they can swallow while I put this in 1 to 2 inches at a time, turning it 180 degrees until I get to the marked thing. I would not try to force this. I would just push it in as it goes. So if the patient coughed throughout this procedure, I would, or had a decrease in oxygen saturation, or showed any signs of respiratory distress, I would need to withdraw the tube into the posterior nasopharynx and allow the patient to have his breathing returned. And then once it returned, I would instruct the patient to swallow before I proceeded with the rest of the procedure. So now that I have this right here, I'm going to temporarily secure it to the side of the cheek. Sorry, I'm not supposed to be pulling this out. It's supposed to stay in there. So I would allow there to be room right there so it wouldn't be pulling. So once that is done, I would take a light and I would shine it in the back of the throat to look at the positioning of the tube and make sure it's not curled up or anything. So then I would attach my 60 milliliter syringe. I would attach that to the end of the NG tube, and that would be right here. And I don't have that today, but I would attach it to there and basically assess the positioning. And so what I would be doing is I would be aspirating gastric contents, assessing the pH if indicated, and having an x-ray done if it was ordered. So the next thing that I'm going to do is I am going to remove the temporary tape, and I'm going to secure it with a more secure tape. So this is the tape that I have prepared. So I'm going to take this one off and dispose of that. And then I'm going to place this. I would first want to prep I would also take this tape off, but I can't really get that off. I would also want to prep the nose before sticking this on there. So once that is on there, I'm going to want to pin the tube to the patient's gown and allowing them to turn their head back and forth. And then I would want to mark the exit marking on the tube with a marker. That way, if it became disconnected or displaced, I would know where the marking was. So the next thing that I'm going to do is I'm going to show how to suction. So what I would do is I would stick this in here, and I'm going to grab my suction tubing, and I would insert it. Once I insert it, I am going to make sure that the blue piggy tail is above the patient's stomach, and then I'm going to, if suction is not required, I'm just going to connect this part right here and then put it above. So the next thing that I would do is I would need to need to make sure that the head of the bed was at least 30 degrees. I would lower the bed to the lowest position again and raise the side rails. I would need to make sure that my call light was available for my patient and that they were comfortable. So the next thing I'm going to do is I'm going to remove all of my equipment. I'm going to remove my gloves. And then I'm going to perform hand hygiene. So now I would do documentation. I would document the size and the type of NG tube, as well as which nair was used at the placement, so either left or right. I would do the time, and then I would do the how it was secured, how placement verified, as well as if suction was used or not. I would also document the patient's how the patient handled the procedure, and then I would document the color amount and characteristics of the secretions. So the next thing that I would do is I would come into the room again, and I would be removing it this time. So what I would need to do is I would come into the room, verify the patient and everything. I would check the order and make sure that it was there. Then I would perform hand hygiene and explain the procedure to the patient. Next, I want to put on my clean gloves. Then I will be assessing the patient's bowel sounds, as well as turning the the suctioning off if it was used. So then the next thing I want to do is I want to place a towel under, and while I remove this, I would want to put a kink in the tubing. So the way I would do this is just kink it like this, and then twist it, and then pull it down. So while I remove this, I would instruct my patient to take a deep breath in and then hold it until I'm done removing. So, I would remove my tape, and also I would remove that, dispose of it, and remove it from the patient's gown. So then when I'm starting to remove, I would instruct the patient to take a deep breath in and hold it, and then I'm going to remove it slowly and steady. And then once I have it out, I will wrap this up and dispose of that. So now I would clean out my area, take off my glove, perform hand hygiene. I would need to measure the drainage, perform oral hygiene, and then I would do the necessary documentation for the patient. I would also need to put the position the bed in the correct area if I moved that or anything. So I would make sure that the patient is comfortable. So this concludes my NG tube check off.